Hi, my name is Claudio. I'm a researcher at IMES Mercosur and made this paper with a colleague from Federal University of Region 4. And we look at a complete diabetes management and care system to help the decision making. Diabetes today was declared a global epidemic in 2012. 372 million people have diabetes, I'm included. And recently we submit this paper at November, and very recently they opened three types of diabetes. Until now was only two types. Type 1, children and juvenile with if your pancreas don't produce insulin, okay? And the type 2, old people or medium-aged people with problems have this type 2. And here we need to talk about the management. Is the frequent monitoring of blood glucose. So you have this kind of how you can management, right? How you can manage this. With a blood glucose meter is a little device that you prick your finger and put the blood in the stick. And this continuous glucose monitoring system is like you put a device in your skin, and for every 30 seconds or 1 minute they took the blood, and you can verify your measure of glucose. But it offers more extensive information, but extremely high cost for the most diabetics over the world. And another particularity of this kind of the system here, this device here, that they produce some kind of analytical information, but because of the extremely high cost, not so much people have access to them. So we identify that traceability between glucose measurement, insulin dose, and carbohydrate intake can provide useful information to physicians, health professionals, and patients. Let's think about the types of diabetes. You have type 1 diabetes. The basic to the management is the insulin. Patients with type 1 diabetes are insulin dependent. If you don't take your insulin, you will die. And type 2, the focus is on dietary. The quantity of carbohydrates you intake. So if you control your food dietary, you can control your diabetes for type 2 diabetes. Okay? And the prevention of hypoglycemic episodes and reduce glycemic variability. You can avoid retinopathy, heart disease, stroke, and neuropathy, just for say a few examples. So this is the GLUMIS system. glucose management information system. You have here previous work that collect the information, real system, insulin dose and diet records, just for record, how much you intake from insulin and what you eat, easy. And this compose the historical data repository, and more with the CGMS and BGM devices information from glucose measurement, okay? And then you have a glucose predictive model, a resonance, and some visualizations. Make better the patient's treatment. The GLUMIS system can integrate data from glucose measuring device. Collected data is used to maintain a knowledge database. Every single decision, for example, change the ratio of insulin you will take. Change now. These decisions are put together in the historical data, providing valuable information to better the patient's treatment. The model prediction is made using a method inspired by fuzzy ART, uses previous glucose measurement to predict future values. Data contains both a glucose value, the time, and the date of when it was measured. The time you can take or consider 9 p.m., 8 a.m., or a time period, morning, after dinner, is more common, okay? Here, this is the whole process, okay? Let's visit these steps. Here, an example of before lunch and before dinner values. Okay, we have a pair of two time periods here. Each terminal node of that tree contains data from one measurement of first period and data from a measured from the second time period. Okay. Epsilon to transform the values into intervals. So we have 8. Here we use the epsilon with 20. Okay. So you have 8 and 160, and so on. Data from two time periods are used to form a tree. It's a bottom-up approach. Each node corresponds to a rule. Nodes with overlapping intervals of measurements are united to form higher levels of the tree. So I have here 178. You combine to make a node with 60 over the 118. Okay? If glucose before lunch is between 80 and 120, then glucose before dinner is between 130 and 170. When we look to this tree, we have more general and less precise at the top of the tree, and less general and more precise at the bottom of the tree. The reliability of a rule is measured by the number of terminal nodes used to create it, and an automatic search for a rule can be done by inputting the desired time periods, like before dinner or before. A reliability threshold, like 3 nodes, 2 nodes, and so on, and the measured value, and the most adjusted rule is found. It's not the best, it's most adjusted. We are at a continuous domain, and this model is only capable of predicting values differing at most epsilon from previous values. This prevents prediction from new values that differ too much from previous ones, making prediction more reliable and safe. This safety is important because wrong predictions can lead to hyper or hypoglycemia. Okay? Here, the prediction tree visualization with some information about carbohydrate intake, insulin applied, the time period, number of occurrence, and the epsilon used, okay, and the date, of course. Here, these details came from the Lelis system. It's another system, okay, and you can select the one that you will use to make some adjustments in the patient's treatment. This is profile view that you can make a profile of the patient, like postprandial breakfast before lunch, postprandial lunch, and you can identify where is the patient have a normal values, how you can change, okay? And this is the traceability view that you, the idea here is to provide to physician a context of the previous values and the next values, okay? And some statistical information here, how much differ from the other values previous, right? This, you can choose time period and you can take this. Evaluation of the information system. We follow the goal question metric framework, and the goal can be set analyze the GLUMIS system in order to verify the feasibility of views with respect to the task of interpreting the views and rules from the point of view of patients and physicians in the context of diabetes management through a decision support system. Were 2 questions for each view. Question 1. The degree of comprehension associated with the visualization and information presented, and the leakage scale was used for the answer of both. The question 2. The view supported the understanding of rules and analysis made by residents. So, real data, 2 consecutive months, data from BGM and CGMS devices, okay? And the time periods, before breakfast, before lunch, and before dinner. At least 25 measurements, in total at least 25 measurements. 9 patients, 1 specialist. After filling out a form characterization, they use the system and analyze the visualizations and then answer the both questions for the 3 visualizations. So we can view here value 3.8 here is call our attention because why this value so different from the other ones, and we observe that for participants they said that historical traceability view would be indifferent. Why? Because prediction tree view shows the same information, but it's not the same. The idea of the contest don't have here. You have here. The contest, what happens previous and what happened next. Okay? And one participant suggested the possibility of defining a desirable or ideal profile. You put the profile and can monitor your profile to match the desirable one. Subtracts to validity. Of course, the reduced number of participants. Participants can represent different profiles. This is the point of view. Despite the reduced number of participants, they can represent different profiles. And the balanced amounts of measurements, an opportunity because different results on database concentrated into specific periods. What happened if you have measures only at dinner and a few ones at the morning? And some future work. A recommendation system indicating possible changes. Now we don't want to switch the physician. They made the decision. We just want to help. Here, a future work. Some approach already exist in this direction. Okay, we are looking for new partnerships and analyze type 1 and type 2 patients, the information between them. That's it.